you go into the second phase. There are new things come up, there are new system coming up, ਹੋਰ ਬੜਾ ਕੁਝ ਹੋ ਰਿਹਾ, ਵੈਕਸੀਨ ਨਿਕਲਦੀ ਹੈ, ਅਸੀਂ ਉਹਦੇ ਬਾਰੇ ਗੱਲ ਕਰਾਂਗੇ. And I can't have anybody better than a professional in medical team ਦੇ ਵਿੱਚ ਡਾਕਟਰ.
ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ, ਨਵੀਂ ਵੀਡੀਓਜ਼ ਦੀ ਨੋਟੀਫਿਕੇਸ਼ਨ ਦੇ ਲਈ ਬੈਲ ਆਈਕਨ ਨੂੰ ਕਲਿੱਕ ਕਰਨਾ ਨਾ ਭੁੱਲਣਾ.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਮੈਂ ਉਸਪਾਲ ਜਾਲੀ, ਹਮੇਸ਼ਾ ਦੀ ਤਰ੍ਹਾਂ ਤੁਹਾਡਾ ਸਵਾਗਤ ਕਰਦਾ ਲੇਟ ਸ਼ੋ. ਅੱਜ ਮੈਂ ਤੁਹਾਨੂੰ ਪਤਾ ਮੇਰੇ ਲੇਟ ਸ਼ੋ 'ਚ ਬੜਾ ਟਾਈਮ ਲੱਗਦਾ ਮੈਨੂੰ ਟੂ ਬ੍ਰਿੰਗ ਇਨ ਦ ਇੰਟੈਲੈਕਚੁਅਲ ਗੈਸਟ. ਗੈਸਟ ਵੀ ਮੈਨੂੰ ਲੈ ਕੇ ਆਉਣੇ ਪੈਂਦੇ ਨੇ. ਅੱਜ ਮੈਂ ਤੁਹਾਨੂੰ ਥੋੜ੍ਹਾ ਦੱਸਵਾਂ, ਪਲੀਜ਼ ਡੋਂਟ ਗੈਟ ਬੋਰਡ ਮੇਰਾ ਸੁਣ ਕੇ ਕਿ ਮੈਂ ਕਿਹੜੇ ਬਾਰੇ ਗੱਲ ਕਰਨੀ ਹੈ. TV ਆਫ ਨਾ ਕਰ ਦਿਓ. ਇਟ ਇਜ਼ ਇੰਟਰਸਟਿੰਗ ਬਿਕੋਜ਼ ਅਸੀਂ ਇਨਫ ਟਾਕ ਕੀਤਾ ਬਾਰੇ ਕੋਵਿਡ ਕਰੋਨਾ ਬਾਰੇ ਗੱਲ ਕੀਤੀ ਹੈ, ਬਟ ਦਿਸ ਇਜ਼ ਸਮਥਿੰਗ ਡਿਫਰੈਂਟ ਨਾਓ ਬਿਕੋਜ਼ ਯੂ ਗੋਇੰਗ ਇਨਟੂ ਦ ਸੈਕੰਡ ਫੇਜ਼. There are new things come up, there are new system coming up, ਹੋਰ ਬੜਾ ਕੁਝ ਹੋ ਰਿਹਾ, ਵੈਕਸੀਨ ਨਿਕਲਦੀ ਹੈ, ਅਸੀਂ ਉਹਦੇ ਬਾਰੇ ਗੱਲ ਕਰਾਂਗੇ. And I can't have anybody better than a professional in medical team ਦੇ ਵਿੱਚ ਡਾਕਟਰ. ਮੈਂ ਬਹੁਤਾ ਟਾਈਮ ਜ਼ਾਇਆ ਨਹੀਂ ਕਰਾਂਗਾ, ਅਸੀਂ ਥੋੜ੍ਹੀ ਬਹੁਤੀ ਗੱਲਬਾਤ ਕਰਾਂਗੇ in detail about COVID ਬਾਰੇ, ਕੀ ਹੋ ਰਿਹਾ, ਕਿਸ ਤਰ੍ਹਾਂ ਹੋ ਰਿਹਾ, what the situation is. ਬਹੁਤ ਲੋਕ carefree ਹੋ ਗਏ ਨੇ because they think this is a drama. Please trust me, this is not a drama. The people, ਤੁਹਾਡੇ ਕੋਈ ਘਰ ਦਾ ਨਜ਼ਦੀਕ ਬੰਦਾ ਅਫੈਕਟ ਹੁੰਦਾ ਨਾ ਕੋਈ ਘਰ ਦੇ ਵਿੱਚ ਐਂਡ ਸਮਬਡੀ ਡਾਈਜ਼, ਦੈਨ ਯੂ ਨੋ ਦ ਬਿਮਾਰੀਜ਼ ਆਊਟ ਦੇਅਰ. ਐਂਡ ਪਲੀਜ਼ ਤੁਸੀਂ ਸੀਰੀਅਸ ਲਓ ਇਸ ਚੀਜ਼ ਨੂੰ. ਆਮ ਨਾਟ ਟ੍ਰਾਈਂਗ ਟੂ ਫਰਾਈਟਨ ਯੂ. ਅੱਜ ਡਾਕਟਰ ਐਕਸਪਰਟ ਹੈਗੇ, ਤੁਸੀਂ ਗੱਲਬਾਤ ਸੁਣਿਓ ਅਤੇ ਮੈਂ ਟਾਈਮ ਨਾਲ ਜ਼ਾਇਆ ਕਰਦਾ. ਉਹਨਾਂ ਨੂੰ ਇਨਵਾਈਟ ਕਰਕੇ ਇੰਟਰੋਡਿਊਸ ਕਰਦੇ ਹਾਂ. ਡਾਕਟਰ ਸਾਹਿਬ, ਵੈਲਕਮ ਯੂ ਟੂ ਦ ਸ਼ੋ. ਥੈਂਕ ਯੂ ਫॉर ਟੇਕਿੰਗ ਟਾਈਮ ਟੂ ਕਮ ਇਨ.
Thank you.
Really appreciate.
Thank you for having me here.
No, it's my pleasure. It's important. ਜਦੋਂ ਦੇਖੋ ਡਾਕਟਰ ਬਿਜ਼ੀ ਹੁੰਦੇ ਨੇ, especially this time, they're in the front line. And ਅਸੀਂ ਉਹਨਾਂ ਨੂੰ ਇੱਕ ਦਫਾ ਰਿੰਗ ਕਰਕੇ ਬੁਲਾਉਂਦੇ ਹਾਂ. They're more than happy to come. ਸਰਵਿਸ ਕਰਦੇ ਨੇ, ਤੁਹਾਡਾ ਭਲਾ ਕਰਦੇ ਨੇ. Please must listen to this. It's important. ਸਾਰਾ ਪ੍ਰੋਗਰਾਮ ਨਾ ਵੀ ਅੱਛਾ ਹੋਏ ਨਾ, ਇੱਕ ਦੋ ਲਫ਼ਜ਼ ਤੁਹਾਡੇ ਦਿਲ ਨੂੰ ਛੂ ਜਾਣਗੇ ਨਾ, ਤੁਹਾਡੀ ਲਾਈਫ ਚੇਂਜ ਹੋ ਜਾਏਗੀ. Don't you think so?
Yes, well.
ਅੰਡਰਸਟੈਂਡ ਕਰਦੇ ਨਾ ਸਾਰਾ.
ਹਾਂਜੀ.
ਡਾਕਟਰ ਜੀ ਪੰਜਾਬੀ ਵੀ ਬੋਲਣਗੇ, ਇੰਗਲਿਸ਼ ਮੈਂ ਪੰਜਾਬੀ ਸਿਖਾ ਦੇਣੀ ਆ. ਇਹ ਨਹੀਂ ਕਿ ਮੈਨੂੰ ਵੀ ਬੜੀ ਆਉਂਦੀ ਹੈ. ਵੀ ਬੋਥ ਗੋਇੰ ਟੂ ਟਰਾਈ ਟੂ ਗੋ ਥਰੂ ਦਿਸ. ਡਾਕਟਰ ਸਾਹਿਬ, ਪਹਿਲਾਂ ਤੇ ਡਾਕਟਰ ਰਣਜੀਵ ਕੋਚਰ ਇਜ਼ ਇਟ?
ਹਾਂਜੀ.
ਬਹੁਤ ਅੱਛਾ ਮੈਂ ਨਾਮ. ਇਜ਼ ਨੋਨ ਐਜ਼ ਅ ਰਾਂਝ ਐਕਚੁਅਲੀ, RANJ. ਪ੍ਰੋਫੈਸ਼ਨਲ ਮੈਡੀਕਲ ਟੀਮ ਦੇ ਡਾਕਟਰ ਹੈਗੇ ਨੇ. ਇੰਸਟੈਡ ਆਫ ਮੀ ਟਾਕਿੰਗ ਅਬਾਊਟ ਹਿਮ, ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਕਹਾਂ ਕਿ ਥੋੜ੍ਹਾ ਬਹੁਤਾ ਬਿਫੋਰ ਵੀ ਸਟਾਰਟ ਟਾਕਿੰਗ ਅਬਾਊਟ ਦ ਕੋਵਿਡ ਸਾਰਾ ਕੁਝ ਕੀ ਹੋ ਰਿਹਾ ਆਪਣੇ ਆਪ ਦੇ ਦੱਸਣਗੇ. Where were you born, medicine ਕਿਉਂ ਕੀਤੀ, ਕਾਹਤੇ ਕੀਤੀ, these kind of things, you know. ਇਹਦੇ ਕੀ ਹੁੰਦਾ ਨਾ, we going to talk about the ਬਿਮਾਰੀ, then it's inspiration for people sitting at home. Yeah, I want to be a doctor. Yeah, inspire you and inspire people sitting at home and helping killing two birds with one stone. Anji, where were you born there?
So I was born in West London.
West London?
West London, I was born here. I grew up locally in Greenford.
Oh, really?
Yeah, so I spent most of my life here and actually went to university in Imperial College, which is Kensington, so not too far from the studio here today.
Why did you know, was there anybody else in the family, like in the background of which?
No, so मेरे family ਦੇ ਵਿੱਚ ਮੈਂ ਹੀ ਪਹਿਲਾ ਸੀਗਾ that went into
Really?
medicine. Yeah.
So ਤੁਸੀਂ tradition break ਕਰ ਦਿੱਤੀ.
Yeah, unfortunately. But my grandfather was a science teacher, and my family were all very much into mathematics and science.
Mathematics.
Hanji. So I think medicine seemed like a natural field because science was my passion. I wanted
right from the young age.
Right from the young age.
But tell me, this is important. I need to know. You know, ਜਦੋਂ ਵੀ ਤੁਸੀਂ ਕੁਝ ਬਣਨਾ, sometimes you want to become a pilot. You're young, 10-12 ਸਾਲ ਦਾ, you see the plane flying, you get inspiration. And ਮੇਰਾ ਇੱਕ friend ਹੁੰਦਾ ਸੀਗਾ, and he was a very big broadcaster, ਉਹਨਾਂ ਦੇ ਰੇਡੀਓ ਸਟੇਸ਼ਨ ਵਗੈਰਾ. ਉਹ ਜਿਹੜੇ ਵਾਇਰਾਂ ਜਾਂਦੇ ਸੀ ਨਾ ਪਿੰਡਾਂ ਦੇ ਵਿੱਚ, he used to think ਕਿ ਉਹਦੇ ਵਿੱਚੋਂ ਨਾ ਆਵਾਜ਼ ਟਰੈਵਲ ਕਰਦੀ ਹੈ. So he wanted to become a broadcaster on a radio station, and he was the owner of a radio station.
Wow.
So you know, how did that penny drop?
Well, originally my football खेलने ਨੂੰ ਚਾਹੁੰਦਾ ਸੀਗਾ. I wanted to play football professionally for, you know, my favorite team, but I realized obviously I'm not good enough, and science was something that I just fell in love with, and obviously through my education it steered me towards medicine, and then I was fortunate enough to get into medical school at a fantastic medical school. And
now to see you do apni personal practice ਕਰਦੇ ਹੋ with some hospitals, or don't naming the...
So I'm a partner in a general practice.
General practice?
Yeah, partner in general practice. And my subspecialty is diabetes, but obviously over the past year, probably nearly a year.
That's your specialty, diabetes.
My subspecialty.
We have to get you back on that actually, because majority log apne jinne bhi is very common in Asians.
Yes.
Very
yes,
common.
We see it quite a bit.
There's no better person than you, at least explain karunge. It's known as the mother of all diseases.
Diabetes, yeah, it can affect lots of different systems. Heart, it can affect your limbs, your eyes, the kidneys. It's an important condition.
Acha, now we're going to talk about COVID, but please proceed. We're going to give you the facts and figures by Ravi Galka. Actually, I can go right at the beginning, the which pella, as you the Galkalene. Jelly update again, please. H2 figure they change. They could be up and down. Thola bahut hamesha farak hunda, so don't hold me for that. Because jo main figure there 100% correct honge. Very much to close. Update jelly hun agi UK di 1.2 million log are affected. You can see on the screen, and that's just over 49,000. UK di hagi, and for the last 24 hours. 21,000 cases bande jasti affect hoye in infection lagi unanu, and 194 deaths with the last 24 hours. So jidam ab shuru ch kya kehte the disease is out there. Please log jadon tonu pata lagda thode close relative da koi hospital pe hai and onu laya utte in the ICU unit de vich, then you know ke waqai bimari hegi ke when jadon banda utte pahunchda main doctor na gal karanga. How many people have come out of there? We don't know that yet. That figure nahi aande. Agar hun je main worldwide di gal karan, just above 51 million tusi dekhde ho screen te local infection hui hai, and just over 1.2 million the death hui hai worldwide. Ode vich just under 35 million jehde na onne recovery kiti hai, 35 million, just over 35 million. So the figures are pretty high. सारे मुल्कों के बीच हाली तो पता है यूरोप देख लो तुसी फ्रांस देख लो इटली देख लो स्पेन देख लो there's problem out there England ਅਸੀਂ ਅੱਜ England ਦੀ ਗੱਲ ਕਰਾਂਗੇ you mind if I call you Ranj?
Not at all.
Ranj Dick I'm sure he doesn't mind. Long COVID, also known as the post-COVID syndrome. And explain karo, what does it really mean?
So COVID, symptoms are that fever, cough, loss of sense of smell is the most common symptoms that we see. And normally symptoms would last a few weeks. These types of symptoms would last a few weeks, and then touch wood, if people are okay, it kind of settles down. But ਹੁਣ ਸਾਨੂੰ ਪਤਾ ਲੱਗਿਆ that actually ਕਈ ਲੋਕਾਂ ਦੇ ਵਿੱਚ these symptoms can persist for much longer than weeks, sometimes months on end. Symptoms such as weakness, tiredness, temperature, there's no other explanation for, muscle aches, and the governing bodies ਜਿਹੜੇ ਹੈਗੇ ਆ ਉਹਨੂੰ ਪਤਾ ਲੱਗਿਆ that actually ਇਹ condition ਹੈਗੀ ਆ. It's a post-COVID syndrome. So ਹੁਣ ਉਹ research ਕਰਦੇ ਆ, ਉਹ ਦੇਖਦੇ ਆ ਇਹ ਕਿਉਂ ਹੁੰਦਾ, what kind of treatments can we offer, how can we support these patients? It's more important.
We're going to talk about the vaccine. आज ही news है, Prime Minister ने statement दी थी, ਉਹਦੇ ਬਾਰੇ ਵੀ ਗੱਲ ਕਰਾਂਗੇ. We go line by line, जो भी सारे question. बाद में ऐसे थोड़ी बहुत ही गाल करते हैं. अगर तुसी कॉल करके कोई अपना सवाल पूछना है, if you're worried, किसी भी तरह ना तुसी सानू कॉल कर सकते हैं 0208 571 4279. अच्छा लगेगा अगर तुहानू किसी चीज़ की कोई चिंता हैगी, वरी हैगी, तुसी कॉल करके डॉक्टर ने पूछ सकते हो. So ਹੁਣ ਜਿਹੜੀ ਨਾ I understand ਜਿਹੜੇ patient ਹੈਗੇ still suffering with symptoms months after ਜਿਹੜਾ ਤੁਸੀਂ ਦੱਸਿਆ ਹੈਗਾ, ਉਹਦੇ ਜਦੋਂ recover ਕਰਦੇ ਉਹਦਾ ਕੋਈ period ਨਹੀਂ ਹੈਗਾ?
As in
how long will it take when that patient is fully recovered and it's okay for him to go around and mingle with other people?
Yeah, so in terms of the symptoms, it varies from patient to patient. Kei loki other which, within 2 weeks they feel much better in themselves. Obviously, Sanupada, from the figures that you've shown, some people become very unwell with this, and lots of people have lost their lives, unfortunately, because of this disease. With this post-COVID syndrome, there's no way of knowing at the moment, ginne jane hegi that they are suffering with this condition, and how many in the future are going to suffer with this condition. And that's why the governing bodies study karde ho, dekhde ya, what is this condition, how many people will suffer, and how can we help these people.
But a latest case hai, main naam nahi lavaga. some girl had this infection, 26, 27 saal di hoegi, and she was in isolation at home, which is a sensible thing to do. But the most unsensible thing was, the mother bhi utthe rehndi si, she's older, like 55, 60. She had ongoing uncountable problems, medical, the history kharab sigi. And once she was in isolation for 2 weeks, she recovered, she went back to work. In the meantime, the mother caught it. And the mother is in ICU unit.
Gosh.
And she's so critical, it's touch and go now.
Gosh.
You know, when मैं इस करके करना तुसी शो देखो, माँ घर सीगे कल्ली और ओदी लड़की ने सोचा कि मैं उन्हें कल्ली नहीं छड़ना, माँ उन्हें कौन लुक आफ्टर करेगा. But the sensible thing is you need to find a way. When Ma is critical in ICU unit, which touch and go, pata nahi bachegi nahi. How would the girl feel guilty right through her life, but knowing or unknowing कि कितनी बड़ी mistake कितनी है उन्हें. That's why we bring these programs to please that चीज़ां दा थोड़ा ख्याल रखो. It's not कि मैं हॉस्पिटल ने मैं रिकवर होगी, मैं घर आइसोलेशन में और मैं ठीक है गया, लेकिन जेने थोड़े घर च बुजुर्ग है गया, they're very vulnerable. They are bound to get this so quicker, and they will be in danger line right from the start. क्योंकि you know, जो older with the medical public history है गया, it takes days for them to just, you know, no collapse, but almost go into a coma. And
in these circumstances, it's very difficult because obviously the guidelines like that actually if you're in contact with a patient who's had COVID, do haftali you should isolate, because it can take up to that time for your symptoms to develop. So it's really important to make sure obviously that we follow the guidelines and take care of others around us as well as ourselves.
एक चीज़ मैं दसना चाहूँगा, प्लीज़ ਜਦੋਂ ਵੀ ਤੁਸੀਂ ਦੇਖਦੇ ਹੋ ਕੋਈ ਮੈਡੀਕਲ ਐਕਸਪਰਟ ਬੈਠੇ ਨੇ ਐਡਵਾਈਸ ਦਿੰਦੇ ਨੇ, lot of time ਤੁਸੀਂ ਵੀਡੀਓ ਵਾਇਰਲ ਹੁੰਦੇ ਆ, please don't take no notice of those. We don't even know ਵੀਡੀਓ ਕਿੱਥੋਂ ਸਟਾਰਟ ਹੁੰਦੀ ਹੈ. Somebody probably sitting in the back room and just sending those videos, ये ना करो वो ना करो, and people start panicking. The latest one, you can confirm that किसी गोरे ने वीडियो होनी वायरल हुई है. This is after 4-5 months. March ਦਾ ਕੰਮ ਸ਼ੁਰੂ ਹੋਇਆ, and he's come up with ਜਿਹੜੀ ਸੁਪਰਮਾਰਕਟ ਦੀ ਟਰੋਲੀ ਹੈਗੀ ਨੇ, ਉੱਥੋਂ ਤੇ ਪੈਟਰੋਲ ਸਟੇਸ਼ਨ ਦੇ ਗੈਸ ਪੰਪ ਤੋਂ ਸ਼ੁਰੂ ਹੁੰਦਾ ਸਾਰਾ. That's the biggest culprit. Is there any truth in that?
There's no evidence behind
a
lot of these conspiracy theories that we're seeing. The government websites actually give a lot of information. So government website, they've got a lot of information about what's happening currently and what they're planning on doing moving forward.
Naturally, मैं बेशक कहना ना कि ਜਦੋਂ ਤੁਹਾਨੂੰ ਕੋਈ ਵੀ ਕਲਿੱਪ ਹੁੰਦਾ ਨਾ, ਸਾਡੀ ਹਿਊਮਨ ਨੇਚਰ ਪਤਾ ਕੀ ਹੈ, ਫਟਾਫਟ ਫਾਰਵਰਡ ਕਰੋ 15 ਜਣਿਆਂ ਨੂੰ, ਉਹ 20 ਜਣਿਆਂ ਨੂੰ ਕਰਦਾ, ਉਹ 40 ਜਣਿਆਂ ਨੂੰ ਕਰ ਦਿੰਦਾ, before you know it's all over the world, and people start panicking. You know, ਤੁਸੀਂ medical advice, this is why we do the show, ਤਾਂ ਕਿ ਤੁਹਾਡੇ ਜਿਹੜੇ intellectual ਬੰਦੇ ਸਾਰੇ professional ਤੁਹਾਨੂੰ advice ਦੇਣ. ਜੋ ਵੀ ਅੱਜ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਾਂਗੇ, ਪਲੀਜ਼ ਅਗਰ ਤੁਸੀਂ ਕੁਝ ਵੀ ਇਹਨਾਂ ਨੇ ਕੋਈ ਗੱਲ ਕੀਤੀ ਕਿਸੇ ਵੀ ਤਰ੍ਹਾਂ ਦੀ, ਜੋ ਮੇਰਾ ਨੈਕਸਟ ਕੁਐਸਚਨ ਹੈ ਬਾਅਦ ਵਿਟਾਮਿਨ ਡੀ ਦੀ ਗੱਲ ਕਰਾਂਗੇ, ਇਫ ਯੂ ਗੋਇੰ ਟੂ ਸਟਾਰਟ ਟੇਕਿੰਗ ਦੈਟ, ਬਿਕਾਜ਼ ਦੇ ਡਾਕਟਰ ਜੀ ਨੇ ਅੱਜ ਮੇਰੇ ਨਾਲ ਗੱਲ ਕਰ ਰਹੇ ਨੇ, always take advice from your GP or the professional ਜਿੰਨਾ ਤੁਸੀਂ ਆਪਣੀ ਮੈਡੀਕਲ ਹਿਸਟਰੀ ਹੈਗੀ ਹੈ. What about the vitamin D? It's known to it's really help ਕਰਦਾ ਉਹਦੀ protection against COVID.
Vitamin D, in the beginning stages of COVID, months ago, this theory was raised as whether vitamin D, COVID na koi protection ho sakda ki nahi. And actually, wo studies karde hai, haje tak bhi karde hai, that they're looking to see whether there is any truth behind this. So vitamin D sanu pata that is good for your bones, for your muscles, and for your immune system. So immune system is very good. And naturally, winter de vich sada vitamin D ghat janda. And that's because the main way that we get vitamin D is through sunlight, so through sun exposure on the skin. But obviously winter the which there's less sun, and also we spend a lot more time indoors, so we generate less vitamin D. Yes, because the darker the skin, the less efficiently you synthesize or you make the vitamin D. So what the NHS do recommend is they recommend, especially during the winter periods, to take vitamin D supplements. It's available on the NHS website. It tells you all the information. But what they do say on the NHS website is at the moment there's not enough evidence to say vitamin D is protective against COVID, or prevent it or treats it. So there's no evidence at the moment that that's the case. But sanu pata that it's very good for your bones, for your muscles, for your immune system. It has got to recommend to take the supplements during the winter period.
Protection hobe na hobe, at least ਉਹਦਾ ਕੋਈ harm ਨਹੀਂ ਹੈ.
For the kind of routine supplements, that's right, yeah. But again, you need to speak to your medical professional if there's any medical condition that you have where you should be careful taking vitamin D.
And if you talk about vitamin D, vitamin C is very helpful as well.
Yeah, there's
Immune system.
Yeah, so there's lots of information about what recommended daily allowance of these vitamins, and a lot of these things, you can get in your diet. Vitamin D, like I said, this is the one that we get mainly from sunlight, so that's why in winter, so it's important to maybe think about getting supplements.
But एक चीज़ हो रही है, ऐसी पहले भी गाल करते सी, we were just talking before the show, मैं हर जगह भी medical show करता हूँ, हमेशा जिक्र करता है कि जो तुमने prescribe की थी ना dosage, please you must stick to that. और लोग जितना सी पहला गाल करते सी, वो कहता मैं ना आज मिठा ज़्यादा खा लिया, तो मैं वो 2 गोलियां खा लेना है. So that doesn't help, does it?
Not at all, no. It's more important चीज़ है that your doctor prescribed करता, that's how you should take it, and never more than what is prescribed.
ਤੁਸੀਂ ਹੁਣ the diabetes expert, we're going to talk one time, hopefully you're going to come back. और ਤੁਹਾਡੇ ਕੋਲ ਮੈਂ promise ਲਵਾਂਗਾ, national TV, you're going to give me a promise before you go, and at least ਮੈਂ ਤੁਹਾਨੂੰ stand ਕਰਾਂਗਾ ਕਿ ਮੈਂ promise ਕੀਤਾ ਸੀਗਾ. You get a lot of people ਏਦਾਂ ਦੇ ਤੁਹਾਨੂੰ ਸਵਾਲ ਪੁੱਛਦੇ ਨੇ ਕਿ ਮੈਂ ਆਪੇ overdose ਕਰ ਦਿੱਤੀ ਹੈ, ਉਹਦੀ dosage ਮੈਂ ਘੱਟ ਕਰ ਦਿੱਤੀ ਹੈ. Do people come to you ਕਿ ਮੈਨੂੰ ਲੱਗਦਾ ਤੁਸੀਂ ਮੇਰੀ ਘਟਾ ਦਿਓ ਹੁਣ?
So I wouldn't say lots, but Haggia patients, they come to us and they say, look, doctor, मैं ये ज़्यादा खा लिया, मैं घट खा लिया, and I always say the same message, that is the most important thing is to follow the guidelines, follow the prescription as we prescribe it, because obviously जे तुसी ज़्यादा गोलियां लेंदे आ dangerous हो सकता है, और जे घट लेंदे आ dangerous हो सकता है. So it's important to consult with the medical professional before adjusting any medication.
Coming back to, मैं थोड़ा jump कर गया, पर जो तो विटामिन डी की गल करते सी, सन के एशियंस बड़ी ओदी घाट हैगी, we are really short of vitamin D because ਅਸੀਂ ਧੁੱਪੇ ਨਹੀਂ ਬੈਠਦੇ. In fact, because ਅਸੀਂ ਠੰਡੀਆਂ ਚ ਰਹਿੰਦੇ ਨਾ, we are so used to living in this kind of dull weather, not too much sunshine. ਜਦੋਂ summer ਆਂਦੀ ਨਾ, we go and sit under the tree. ਉੱਥੇ ਵੀ ਜਾ ਕੇ ਅਸੀਂ ਨੇ ਸ਼ੇਡ ਚ ਬੈਠ ਜਾਏ. ਬਸ ਉਹਦੇ ਬਾਰੇ ਤੁਸੀਂ ਦੇਖੋ. Actually, put that key haga, I'm not blame ni karda. Sometimes if people are not used to sitting in the sun, they get a headache if they sit in the sun for too long.
Yeah, it's important to be sensible about this because, excess sun exposure with risk of burning, these have risks themselves. So it's really important not to do those types of things. But like I said, the NHS website is very, very good. It gives good guidance on this type of thing.
But you can ho rahi na. ਸਾਡੇ ਸਪੈਸ਼ਲੀ ਮਾਮਾ ਕਹਿੰਦੇ ਆ ਕਿ ਮੇਰੀ ਧੀ ਹੋਵੇ, ਮੇਰਾ ਪੁੱਤਰ ਹੋਵੇ, ਕਾਲਾ ਨਾ ਹੋਵੇ, ਉਹਦਾ ਵਿਆਹ ਨਹੀਂ ਹੋਏਗਾ. ਉਹਦੇ ਕਰਕੇ ਵੀ they don't want their children to sit in the sun. We are very much conscious about the color, na, dark color ਦਾ, ਕਿ ਉਹਦਾ ਵਿਆਹ ਨਹੀਂ ਹੋਏਗਾ, ਕਿ ਉਹਦਾ ਪੁੱਤਰ ਕਾਲਾ, ਜਿਹਦੀ ਧੀ ਕਾਲੀ ਹੈ. ਫਰਕ ਪੈਂਦਾ ਉਹਦਾ ਕਿ ਨਹੀਂ?
Not that I've seen. I don't know these things, but like I said, the main reason winter, ਸਾਰੇ ਦਾ vitamin D ਘੱਟ ਜਾਂਦਾ because there's less sun, and ਠੰਡ ਕਰਕੇ we spend a lot more time indoors.
ਹੁਣ ਪਤਾ ਕੀ ਹੈ, ਅਸੀਂ ਦਾਨ ਦਾ ਥੋੜੀ ਗੱਲ ਕਰਾਂਗੇ. ਮੈਂ ਜਦੋਂ ਪਹਿਲਾਂ ਕਹਿ ਕੇ ਤਾਂ ਪਲੀਜ਼ ਕਾਲ ਕਰਕੇ ਤੁਸੀਂ ਜੋ ਵੀ ਸਵਾਲ ਪੁੱਛਣਾ ਕਰ ਸਕਦੇ ਹੋ. 0208 571 4279. Give us a call, would be nice to hear from you. ਹੁਣ ਪਤਾ ਕੀ, ਜਦੋਂ ਮਾਰਚ ਵਿੱਚ people started panicking big time, shock, and economy hit ਹੋਈ, depression hit ਹੋਈ badly, people are suffering from that. ਅਸੀਂ ਗੱਲ ਕਰਾਂਗੇ ਇਹਦੇ ਫਾਇਦੇ ਕਿ ਨੁਕਸਾਨ. ਮੈਨੂੰ ਫਾਇਦਾ ਤਾਂ ਕੋਈ ਦਿਖਾਈ ਨਹੀਂ ਦੇ ਰਿਹਾ ਐਕਸੈਪਟ ਕਿ ਇਨਫੈਕਸ਼ਨ ਘੱਟ ਹੋਏਗੀ, ਹੋਰ ਤਾਂ ਕੋਈ ਦਿਖਾਈ ਨਹੀਂ ਦੇ ਰਿਹਾ. Second phase which now we're going again, and there are rumors as well. ਜਦੋਂ rumor ਹੁੰਦੇ effect ਹੁੰਦਾ, ਜਦੋਂ ਪਹਿਲੇ ਹੀ ਹੋਈ ਸੀ lockdown, they said ਕਿ we might have a second one. One kind we might have the third one. When this is going to end? When you see now, I don't know how far this is going to go on, because people are really frustrated now. A lot of people demonstrate kita London the beach. They were against the lockdown. ਉਹਦੀ ਵੀ ਮੈਂ ਗੱਲ ਕਰਾਂਗਾ ਕਿ ਕਿਉਂ ਗਵਰਨਮੈਂਟ ਕਰਦੀ ਹੈ. ਪਹਿਲਾਂ ਮੇਰਾ ਇਹ ਦੱਸੋ ਕਿ ਇਹ ਹੁਣ how long do you see this is going to carry on? Because are we going to see the normal life back again?
So globally, the way that this condition will end, the way that COVID-19 will end. I think everyone has the same thought. There's kind of two ways. Number one is a vaccine. But it's simple cheese niya because it's quite complicated. With a vaccine, it has to be effective, first of all, and that effect has to be long lasting, and it has to be safe. Obviously, GRC vaccine, then I have to use the whole population. It has to be safe. You know, it can't have severe side effects. And with those things, then we have to vaccinate, you know, a lot of the population to protect them from this disease. And the other thing is, jere rege are the ones that contract the condition. We have to have effective treatments to treat those patients. When these conditions are satisfied, that's when we will beat this disease. And the government, the governing bodies, scientists, they're working very hard on these things.
ਅਸੀਂ ਵੈਕਸੀਨ ਦੀ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਗੱਲ ਕਰਾਂਗੇ ਟਾਈਮ ਬੜਾ ਥੋੜਾ ਰਹਿੰਦਾ ਪਰ I still going to stress on this ਬਹੁਤ important ਹੈਗਾ because you know I think it's really worrying for people out there. That's why they're going into depression. Some of the families being locked down for such a long time. Some people have made a nice little nest and they're very happy with their lifestyle. And it will be very difficult for them to come back into the original life, jo pehla hundi si, fast life, running around, carefree, bagara. And people are gone so lazy, so relaxed at home. For long didn't help. It helped in a way. People could actually have a food on the table. ਤੇ ਉਹਦਾ ਫਰਕ ਵੀ ਨੁਕਸਾਨ ਵੀ ਹੈਗਾ but you being a medical team and the government ਵੱਲੋਂ ਕੁਝ ਦਿਖਾਈ ਨਹੀਂ ਦੇ ਰਿਹਾ ਕਿ is there a light on the end of the tunnel? Are we going to see, how soon we going to see this? This one is taken almost a year now, will be by another few months back. Are we going to see something similar in 2021?
The difficulty is there's no way of knowing exactly what date things will get better, but there's lots of positive things coming out in the news today. You may have seen about the vaccine that has 90% efficacy. That again, more data needs to come out. So end of November again, I think, or early December, the safety data will come out and we'll get more information. But the government ministers, a lot of people seem very positive about this step. So it's hopefully moving in the right direction.
बहुत गुड न्यूज़ है आज प्राइम मिनिस्टर ने वैक्सीन की न्यूज़ दी थी ਅਸੀਂ ਉਹਦੇ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਗੱਲ ਕਰਾਂਗੇ because very shortly we're going to go for a break. ਜਿਹੜਾ COVID lockdown ਹੈਗਾ and totally we are blindfolded at the moment. There are a lot of things going on. The medical ਜਿਹੜੇ ਹੈਗੇ ਨੇ officers ਵਗੈਰਾ scientists ਹੈਗੇ ਨੇ the government ਹੈਗੀ ਹੈ things are coming out of them ਪਰ ਕੋਈ surety ਨਹੀਂ ਦੇ ਰਿਹਾ ਕਿਸੇ ਵੀ ਤਰ੍ਹਾਂ ਦੀ at the moment. ਦੋ ਅੱਜ ਪ੍ਰਾਈਮ ਮਿਨਿਸਟਰ ਦੀ ਅਸੀਂ ਗੱਲ ਕਰਾਂਗੇ ਕਿ ਬੇਸ਼ੱਕ ਵੈਕਸੀਨ ਨਿਕਲਦੀ ਹੈ ਪਲੀਜ਼ ਡੋਨਟ ਗੈਟ ਟੂ ਐਕਸਾਈਟਡ ਕਿ ਤੁਸੀਂ ਕੇ ਫ੍ਰੀ ਫਿਰਨਾ ਸ਼ੁਰੂ ਕਰ ਦਵੋ ਐਂਡ ਡੂ ਨਾਟ ਫੋਲੋ ਦ ਗਵਰਨਮੈਂਟ ਗਾਈਡਲਾਈਨ ਬਿਕਾਜ਼ you can only get the vaccine if it's approved and it works. It's a long way out at the moment, but it's happening. But at the moment, we still got to follow the government's guideline 100%.
Yeah, more important, yeah. More important, yeah. It's very important to follow what the government are saying because all guidelines produced there to protect everybody. ਸਾਰੇ ਨੂੰ protect ਕਰਨਾ ਚਾਹੁੰਦੇ ਆ.
But yeah, Ranj, looking like the local vicinity around where we live here, people were very strict in the March. ਜਦੋਂ ਪਹਿਲਾ lockdown ਹੋਇਆ ਸੀ, very careful. People want to go see each other, you want to talk to each other, people would wear the mask. There were hardly anyone in the streets. Now most of the streets are very much like, okay, not normal, but the people are there.
Yeah, lockdown or the government bring this in because they see that the daily cases were rising. And that's when they confirmed that this was the second wave of the disease. And because of that, they decided, the Prime Minister wanted to avoid lockdown. He mentioned it. But the reason why he's brought it into place is because they were worried about the daily cases increasing and then the deaths increasing. And that's what they ultimately want to avoid. So lockdown, obviously, they brought into place. And it's important that people follow what the government are saying.
Last 24 hours, they reached 21,000. Did I say that 21? Yeah, 21,000 people got infected. That's a lot of people.
Yes, absolutely.
The rate bada high hai, and within 24 hours they reach. And 194 deaths. That's extremely high.
Yes.
Which could be I would say quite easily avoided. It can be avoided, but it's not even difficult. Not to follow government guideline.
Yeah, absolutely. It's very important. Where they're saying 21,000 cases, they're doing a lot more testing now as well. So obviously March, April, inna test nahi karde sige. So that's the reason why the data is showing there's far more people now proving positive with the disease. But, you know, it's really important to follow what they say to see the positive effects, hopefully, in the coming weeks.
नहीं आई कि बड़ा तुसी बड़ा अच्छा सवाल, very debatable. I'm just catching you what you just said. Though there are a lot of tests happening now, but this is not somebody been carrying the infection last 2-3 months. It's recently where now, Rufir.
Yes.
Though the tests are happening, but that doesn't mean कि test हुए थे उन्हें पकड़ लेता. But this is the recent case.
Yeah. So normally, 2 hafte baad, when patients deteriorate with this disease, and it can take 2 weeks for them to deteriorate to the stage where they pass away.
पता बहुत तुसी careful रहो. These government guidelines you have to follow 100%. पता at the moment क्योंकि थोड़ी ऐसी figure दसने fact दसने ताकि थोड़े पता लगना चाहिए. जिदा मैं थोड़े एक lady दी example देती है. ਜਦੋਂ ਕਿਸੇ ਦਾ ਘਰ ਵੱਲੋਂ ਨਾ ਬਲੱਡ ਲਾਈਨ ਦੇ ਵਿੱਚ ਤੁਹਾਡਾ ਕਿਸੇ ਦੇ ਇਦਾਂ ਦਾ ਹਾਦਸਾ ਹੁੰਦਾ ਨਾ, then you get a wake up call, then you know ਕਿ there's a ਬਿਮਾਰੀ out there. At the moment ਲੋਕੀ ਪਤਾ ਕਿ ਮਤਾਈ ਮੈਂ ਸ਼ੁਰੂ ਚ ਗਿਆ ਸੀਗਾ, ਉਹ ਅਕਾਲ ਚੈਨਲ ਅੱਜ ਫਿਰ ਕੋਵਿਡ ਦੀ ਗੱਲ ਕਰ ਰਹੀ ਹੈ, ਇਹ ਤਾਂ ਮਾਰਚ ਦੀ ਚੱਲਦੀ ਹੈ, ਬੋਰਿੰਗ ਹੋਗਾ ਤੇ ਸਵਿਚ ਆਫ ਕਰ ਦਿਓ ਟੀਵੀ. ਪਲੀਜ਼ ਡੋਂਟ ਡੂ ਦੈਟ, ਇਟ ਕੈਨ ਸੇਵ ਸਮਬਡੀਜ਼ ਲਾਈਫ. ਕੁਛ ਨਾ ਕੁਛ ਇੰਟਰਸਟਿੰਗ, ਕੁਛ ਨਾ ਕੁਛ ਅੱਛੀ ਗੱਲ ਹੋਏਗੀ, ਤੁਸੀਂ ਵਾਚ ਕਰੋ. ਆਈ ਥਿੰਕ ਵੀ ਬੀਨ ਟਾਕਿੰਗ, ਆਪਾਂ ਥੋੜੀ ਬ੍ਰੇਕ ਲਈਏ. Are you okay with the break?
You're the boss, but you're the boss.
Thank you very much. Ashi, please थोड़ी सी break लेने. Don't go too far. Thank you जी. सत श्री अकाल.
ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ, ਨਵੀਂ ਵੀਡੀਓਜ਼ ਦੀ ਨੋਟੀਫਿਕੇਸ਼ਨ ਦੇ ਲਈ ਬੈਲ ਆਈਕਨ ਨੂੰ ਕਲਿੱਕ ਕਰਨਾ ਨਾ ਭੁੱਲਣਾ.
Welcome back in the second part. अगर तुसी हुनी देखिया, अगर डॉक्टर रंजीत कोचहर, उन्होंने दा या दूसरा निकनेम है Ranj, कोविड बारे गल करदे हैं. We're not talking like every time COVID ਦੀ ਗੱਲ ਕਰਦੀ. ਲੋਕ ਫੈਡ ਅਪ ਹੋ ਗਏ ਨੇ. मैं कोशिश करदा कि कुछ ना कुछ इंटेलेक्चुअल कुछ अच्छी गल लेके आइए थोड़े पास, ताकि थोनू लगे कि अच्छा शो सीगा. आई एम ग्लैड कि मैं इदां दी इन्फॉर्मेशन लेके आया. वी ट्राइंग टू डिग समथिंग मोर जो नवा हो रहा कोविड बारे. नवा ये हो रहा कि असी भुल गए हैं कि कोविड खत्म नहीं होया हाली, इट्स स्टिल आउट देयर. This is what I'm trying to remind you, and this is why ਜਿਹੜੀ infection rate ਵੱਧ ਰਹੀ ਹੈ, because ਸਾਡੇ ਮਾਈਂਡ ਦੇ ਵਿੱਚ ਹੈਗਾ ਇਹ ਡਰਾਮਾ ਹੈ. lot of people say that actually.
That.
Okay, this is a drama. There's nothing out there. Yeah. That's why we're giving those figures, UK and the worldwide. Because these are the people got infected. These are how many people have died. And last 24 hours, there was the second local infection. Yeah. Though there are more stations testing there, but then because people are getting infected, that's why they want to go get it tested.
Yeah, the good thing is media, the which coverage both there in terms of the news and all the conde are actually that this condition is affecting lives. There's lots of, unfortunately, there's lots of deaths that are being reported each day. And hopefully, by that reminder, people follow the guidelines, people take this seriously and try to protect themselves and others.
I've got a very good question, Doctor. मैं पूछ रहा हूँ. This is important for you, very important. Please तुसी अनु ध्यान ते जरा सुनना. Flu and COVID. I'm going to mix the question together now. What's the difference or the risk in both of them?
Yeah.
Pehla tusi explain karo, then I'll extend the question again.
So this kind of time of the year, general practice, we, over the past few years, we tend to see lots of colds, and we see the flu. If flu season can be the flu is a condition that can be very dangerous. 4,000 to about 22,000 people in the UK each year die from influenza.
They die from that flu.
Die from flu, hanji. And it's obviously a really important condition to remember. But the signs and the symptoms can be very similar to COVID. So cough, muscle aches, temperature, it can cause very similar symptoms to COVID-19. Can you differentiate between them? The only way is by getting the COVID test done. So government guidelines are clear. If you lose your sense of smell, then you should get a COVID test. And these things, as I said, can happen with the flu. The thing with the flu is it's a different virus to COVID-19. So theoretically, you could have the flu and COVID-19. So दोनों हो सकते इकट्ठे. And scientists think that if you get it together, there's a risk that you could be far worse off. So far, more unwell.
Because you got them both together.
Yeah, exactly. And it has got to that, you've got to take care, you've got to be careful. Flu vaccination program hegi obviously in the National Health Service. This has been going on for years, and this year is no different. They are vaccinating. General practice is vaccinating patients for the flu. Anyone over the age of 65, and there's lots of other reasons to have the flu vaccination. It is thoda different here because NHS kende that if you're over the age of 50 or chonde that you get a vaccination, but hajine. They'll let patients know when the time is right. The first priority is to vaccinate the most vulnerable.
But you know, this is the worst time of winter months. Some people, regardless ki karna, wo kehte sanu winter flu ta hunda hai. Because the person I'm talking, jitna bhi hunda hai, his assumption ch hega ke chalo ji manu te flu hega, manu pishle saal bhi 5-10 saal to hunda aa raha, and whereas it could be a combination of both.
So more commonly, we get colds rather than influenza, which is the flu. When patients get the flu, they can become very unwell. So, muscle aches, they struggle to walk around. And obviously, if that happens, you'd seek medical attention. But like I said, this year, the complication here that we've got COVID-19. And the symptoms are very similar. But also, if you get donne disease, then there's a risk that you could become far more unwell. Far more unwell. So he's got to be very careful.
But Dr. Ranj, it's please to see worry na, but I have to say I'm contradicting myself. 1 minute मैं कहना to see worry na karo, दूसरे time पे मैं कहना please you must be careful की हो रहा. This is very important. Nobody has actually discussed about flu and the COVID together. You can imagine ਜਦੋਂ ਤੁਹਾਨੂੰ flu ਹੁੰਦਾ how seriously you are ill in bed. And not knowing that COVID hega, that's a killer. Banda lagda ki it's very frightening. I can't imagine कि banda situation होएगा वो कितना handle करेगा.
So again, important because we've had patients that present to us and say, they have a cough, for example, a very mild cough, and they say, look, I'm sure it's not COVID, but actually that's not necessarily the case because COVID-19 it can cause lots of symptoms in lots of people. It varies massively. So, people say they may have the flu and not COVID, but the only way of knowing is, getting the test if you meet the criteria.
Getting the test done.
Test karke fir pata lagda as in, which one it is or whether it's COVID-19.
पहले मार्च विच में पहले बड़ी दफा शो मेरे रिपीट किया है. People were so conscious look at it. पता है dogs got a habit of sneezing. जो dog sneeze करता सी लोग दौड़ चलते सी उधर. होते कुछ भी होता रहा, they just sit there, they think कुछ नहीं हो रहा. I don't know, पता नहीं की गाला. Please अब हमारी नु serious लवो. बड़े लोगों के घर उजड़ गए ने, किसी दे बुजुर्ग, किसी दे बच्चे, कोई ना कोई one way or the other किसी नु अगर इन्ने बंदे दुनिया दे UK दे विच डेथ हुई है ने, जो मैं तुहानू फिगर दस्या, their family members gone, and उन्होंने पूछ के देखो how they must be feeling about it. ਅਸੀਂ ਬਾਕੀ ਸ਼ੋਅ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡੇ ਪਾਸ ਫੈਕਟ ਫਿਗਰ ਲੈ ਕੇ ਆਂਦੀ ਕਿ ਇਦਾਂ ਹੋ ਰਿਹਾ. ਤੁਸੀਂ ਆਪਣਾ ਬਿਲਕੁਲ this is the worst time now. Winter much dark days ਹੋ ਗਏ ਨੇ, short days ਹੈਗੇ ਨੇ, long nights ਹੈਗੇ ਨੇ, ਬਿਮਾਰੀ ਹੈਗੀ ਹੈ, very little help out there. when it's a very little ਤੁਸੀਂ reluctant ਹੋ ਕੇ ਡਾਕਟਰ ਨੂੰ ਬੁਲਾਵਾ ਨਾ ਬੁਲਾਵਾ, ਉਹ ਆਂਦੇ ਵੀ ਨਹੀਂ ਬਹੁਤੀ ਛੇਤੀ until unless some serious case. ਤੁਸੀਂ ਦੱਸੋ ਕਿ ਮੈਨੂੰ ਕੀ ਹੈਗਾ. How you explain?
Yeah, general practice. The important message that I wanted to get across is GPs have been open this whole time. So GP surgeries are band nahi hunde. What we've done is COVID karke sab the most important cheez hai to protect patients. And obviously pehla time, last year for example, patients would sit in a waiting room katte bende sige, and if that carried on with COVID-19 around, if one patient had it, the risk is everybody in the waiting room
obviously
would have it. And this would be very dangerous because people who come to general practice are unwell, and they have lots of other medical problems. So general practice has, like hospitals as well, they've had to change how they practice. And what we do is we telephone patients. So we telephone, and if there's
telephone consultation, they have no person in the beach.
No, it's a telephone consultation. Karde ta video consultation we kar sakde hai, photos patients sanu page sakde hai, and actually if we need to see the patient, we bring them in. So I see patients every day since the beginning of lockdown.
Really?
Face to face.
But a lot of GPs don't do that actually.
Every GP practice, every GP that I know is exactly the same way. We first call the patient, telephone triage, and je sanu dekhna paina, we will call the patient in. We have our protective gear, and all parke we will see the patient because patients come first. Duje bimariya jehde hegi they still exist, they're still around. You know, patients who have problems with their stomach, problems with their hearts, patients, you know, all these different medical conditions, all haje hegi, and it's important to make sure we don't forget about that in light of COVID-19.
But Dr. Ranj, this is very interesting to say, Gal Dasiya. We've been talking about NHS, we're talking about the heroes in the front line. Has anybody told about the GPs? They might not be in the front line, but they're the higher risk because anybody could be a carrier and you're seeing that patient.
Yeah, and there have been GPs that have passed away because of COVID-19.
I know, a lot of GPs, eh?
Yeah, and the important thing to remember is, you know, the healthcare team, you know, work together to help ultimately patients. And you know, all of my GP colleagues, they've done a wonderful job. They've kept their doors open. Patients that need to be seen, or there, and actually the advantage is it relieves pressure from the hospitals because rather than a patient going to A&E, if it's not an accident or emergency, they contact their GP. GP then gal kar sakde, and hopefully the GP can sort out whatever condition or thing they're worried about.
Dental surgeries was the other one, the biggest problem in the first lockdown they reached. And there were hardly any dental surgeries which were open. You had to call them emergency. Sometimes they're miles away, go to travel, or you might have to go into the hospital, which they were not very strongly recommending get to see hospital. And people were stuck, very difficult.
Dental surgery, obviously, not being a dentist, I'm not sure exactly what happened inside and out, but their job was different in that obviously they're dealing with the mouth, they're dealing with the airway, and there's much higher risk for them to contracting COVID, for other patients to get COVID. And it was a very tough situation, I think, for everybody in the world, not just the dental profession and the healthcare.
अच्छी थोड़ा बहुत हम वैक्सीन की गल करते हैं दोनों हमें बहुत लोग की अपने बुजुर्ग जेड़े इंग्लिश चैनल नहीं देखते दिस इज व्हाई अकाल चैनल देखा और मैं हमेशा कहता हूं ना जरूरी नहीं कि मेरा प्रोग्राम देखना पर मैं कोशिश करदा हूं कि कोई ऐदा दा लेके आवां जो तुसी घर बैठ के मिस कर दिंदे हो एंड अकाल चैनल ते ਅਸੀਂ ਉਹੀ ਕੋਸ਼ਿਸ਼ ਕਰਦੇ ਆ ਜਿਹੜੀ ਨਿਊਜ਼ ਹੁੰਦੀ ਹੈ ਹਰ ਚੈਨਲ ਦਾ ਇਹੀ ਮਕਸਦ ਹੁੰਦਾ ਵੀ ਵਾਂਟ ਟੂ ਬੀ ਦ ਫਰਸਟ ਵਨ ਟੂ ਬ੍ਰਿੰਗ ਇਟ ਆਊਟ अगर कल की न्यूज़ है तो बही हो जाते पुरानी जिदा तुसी खाना बेहा नहीं लाइक करते इस तरह असं न्यूज़ बही नहीं लाइक करते वी वांट टू गिव द फ्रेश अज ये अपने प्राइम मिनिस्टर बोरिस जॉनसन ने कहा इफ एंड व्हेन जो वैक्सीन साल के एंड तक निकलेगी अगर ये अप्रूव होगी एंड यूके इज क्वाइट हैप्पी कि उन्होंने टू पुट बैक इनटू द पब्लिक ना उन्हें यूज़ करेंगे ਉਹਦੇ ਬਾਰੇ ਤੁਸੀਂ ਕੀ ਕਹਿੰਦੇ ਹੋ ਬਾय द वे मैं दसना चाहां अबाउट 40,000 ਬੰਦਿਆਂ ਤੇ ਇਹਨੂੰ ਟੈਸਟ ਕੀਤੀ ਗਈ ਹੈ in 16 countries ਦੇ ਵਿੱਚ and 90% success rate ਹੈਗਾ ਜਦੋਂ ਕਹਿੰਦੇ 90% success rate ਹੈਗਾ ਪਰ ਉਹਦੇ ਨਾਲ ਗਾਰੰਟੀ ਨਹੀਂ ਦਿੰਦੇ ਕਿ 100% ਹੈ very clever way to say that because they're not committing themselves ਤੁਸੀਂ ਉਹਦੇ ਬਾਰੇ ਕੀ ਕਹੋਗੇ
so all preliminary reports ਹੈਗੇ ਆ that actually this vaccine is 90% effective at protecting a patient from COVID-19 but there are so many other factors ਸਾਨੂੰ ਦੇਖਣਾ ਪੈਣਾ that number one, what's the safety data of this vaccine? Number two, how long does this protection last for? He questions Haji Hagia, but this trial is still going on. So Haji, they're still collecting the data, and more information will come out in the coming weeks. The important thing is that, or the positive thing is that there is a vaccine. They're trialing it, on a large scale.
It was large, but 40,000 people, a lot of people that is.
Yeah.
We'll continue with that vaccine. We'll take a call. Yeah. Hello जी सत श्री अकाल
हेलो सत
श्री अकाल जी स्वागत करते हैं कौन बोल रहे हो कितने बोल रहे हो
अकाल सिंह तो बोल रहे हैं पाला जोहल
हाँ जी स्वागत करते हैं वेरी नाइस थैंक यू वेरी मच कि ਤੁਸੀਂ ਪੜ੍ਹ ਲੈ ਰਹੇ ਹੋ ਕੀ ਕਹਿਣਾ ਚਾਹੁੰਦੇ
मैं want to say कि जितना ਹੁਣ ਆਪਣੇ ਗੁਰਦੁਆਰੇ ਜਾਂ ਕੋਈ ਜੋ anywhere ਆਪਣੇ ਡੀਲ ਨਹੀਂ ਕਰਦੇ ਬੰਦੇ they don't adhere to rules they're not adhering to the what the government's saying wear a mask whether it's and keep your social distance it's not happening it's a farce you can go to shops restaurants everywhere so basically we have to look after ourselves it's not the doctor's fault it's not anybody's fault you know, है ना, तो समझे ना कि यार
नहीं मैं बिल्कुल समझ गया पर भाजी थोड़ा सवाल बहुत अच्छा है आई एम ग्लैड टू बॉट दिस अप बिकॉज किसी भी तरह का सवाल है भाई इंटरेस्टिंग होता मैं कोशिश करदा डॉक्टर ते मैं ਅਸੀਂ ਉਹਦਾ ਆਨਸਰ ਦਵਾਂਗੇ ਭਾਜੀ ਜੇ ਤੁਸੀਂ ਹੁਣ ਗੁਰੂ ਘਰ ਦੀ ਗੱਲ ਕਰਦੇ ਹੋ ਮੈਂ ਸਪੈਸ਼ਲ ਫਿਰ ਅਕਾਲ ਚੈਨਲ ਦੀ ਗੱਲ ਕਰਾਂਗਾ ਅਸੀਂ ਗੁਰੂ ਘਰਾਂ ਦੇ ਵਿੱਚ ਜਾ ਕੇ ਹੀ ਪਹਿਲੇ ਲੋਕਡਾਊਨ ਦੇ ਵਿੱਚ ਤੁਹਾਨੂੰ ਦੱਸਿਆ ਸੀਗਾ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਬੰਦੇ ਜਾਂਦੇ ਨੇ ਵਨ ਵੇ ਸਿਸਟਮ ਰੱਖਿਆ ਸੈਨੀਟਾਈਜ਼ਰ ਦਾ ਇੰਤਜ਼ਾਮ ਕੀਤਾ ਪਿਆ ਆਰਓ ਰੱਖਿਆ ਹੋਇਆ ਉਹਨਾਂ ਨੇ ਮਾਸਕ ਪਾ ਕੇ ਜਾਣਾ ਫਲਾਣਾ 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 ਹਰ ਤਰੀਕੇ ਦੀ ਗਵਰਨਮੈਂਟ ਗਾਈਡਲਾਈਨ ਗੁਰੂ ਘਰ ਫੋਲੋ ਕਰਦੇ ਸੀਗੇ ਹੁਣ ਅਗਰ ਆਪਣੇ ਲੋਕ ਨਹੀਂ ਫੋਲੋ ਕਰਦੇ ਉਹਦੇ ਵਿੱਚ ਨਾ ਤੇ ਗਵਰਨਮੈਂਟ ਦਾ ਫਾਲਟ ਹੈ ਤੇ ਡਾਕਟਰ ਦਾ what would you like to say on that ਬਾਕੀ ਦੂਸਰੀ ਗੱਲ ਹੀ added on the public on the supermarkets ਵਗੈਰਾ ਸ਼ਾਪਾਂ ਤੇ ਸ਼ਾਪ ਜਾਂਦੇ ਨੇ actually Dr. Ranj this is a true fact ਮੇਰਾ ਕਿੰਨੀ ਦਫਾ अवन से झगड़ा होया मेरे पीछे बंदा खड़ा होकर मैं कहूँगा पाजी प्लीज कीप अ डिस्टेंस फॉर 2 मीटर दे गिव मी अ डर्टी लुक समटाइम्स दे डोंट मूव फ्रॉम देयर इट्स वेरी अनोइंग इन्होंने फोन किया मैंने बड़ा अच्छा लगे द प्रॉब्लम असी खुद क्रिएट करते हैं दैट्स वाई इन इन्फेक्शन रेट इंक्रीज हो रहा है तुसी बाहर सुपरमार्केट ऑर्डनरी दुकानों ते जाओ गवर्नमेंट ने एटलीस्ट जेडे एसेंशियल शॉप्स बंद नहीं की नॉन एसेंशियल बंद है ने लेकिन उसके बावजूद असि बिहेव नहीं करते पे आई एम सॉरी टू से दैट बिकॉज वी आर द पीपल हु आर क्रिएटिंग दिस प्रॉब्लम
So more important, yeah, is the medical profession's responsibility and thought responsibility in the media to convey the message and educate people that actually the measures such as wearing a mask, they protect others. You know, social distancing, you know, the further that we are from a person, the less risk they can catch coronavirus.
Exactly.
Washing hands, you know, it's more important, yeah, because the droplets, you know, that if a patient is infectious and the droplets that come from their airways, if it lands on a surface, you know, it can survive for hours to days. And if we touch it with our hands and then touch our face, there's a risk that RCV coronavirus we contract kar sakde hain. Is karke wo kende you know, wash your hands, social distance, wear a mask. And it's important for yourself, for medical professionals to just relay that message constantly because, you know, we showed the figures earlier, the number of people that have this disease, the number of people that have unfortunately died from this disease. So it's really important that everybody follows these guidelines.
ਅਸੀਂ 3-4 ਗੁਰਦਾਰੇ ਵੱਡੇ ਗੁਰਦਾਰੇ ਲੰਡਨ ਦੇ ਵਿੱਚ ਸਪੈਸ਼ਲੀ ਲੰਡਨ ਤੋਂ ਬਾਹਰ ਵੀ ਅਕਾਲ ਚੈਨਲ ਤੋਂ ਰੀਸੈਂਟਲੀ ਵੀ ਅਸੀਂ ਦਿਖਾ ਕੇ ਹਟਿਆ ਸ਼ਾਰਟ ਇੰਟਰਵਿਊ ਵਿਦ ਗੁਰੂ ਘਰਾਂ ਦੇ ਨਾਲ ਉੱਥੇ ਆਪਣਾ ਲੰਗਰ ਵਗੈਰਾ ਨਹੀਂ ਬਣਦਾ ਪ੍ਰਸ਼ਾਦ ਪੈਕਟਾਂ ਚ ਦਿੰਦੇ ਨੇ ਐਂਡ ਪ੍ਰੋਪਰ ਗਵਰਨਮੈਂਟ ਦੀ ਗਾਈਡਲਾਈਨ ਫੋਲੋ ਕਰਦੇ ਨੇ ਪਰ ਦੇ ਆਰ देयर ਟੂ ਵਾਚ ਦੈਟ ਕਿ ਅਸੀਂ ਓਬੇ ਕਰ ਰਹੇ ਹਾਂ ਲੇਕਿਨ ਕਈ ਦਫਾ ਅਸੀਂ ਫਿਰ ਬ੍ਰੇਕ ਕਰ ਦਿੰਦੇ ਵੀ ਡੋਂਟ ਫੋਲੋ ਦੈਟ 100% ਹਾਂ ਦੁਕਾਨਾਂ ਦੇ ਵਿੱਚ ਪ੍ਰੋਬਲਮ ਹੈ ਐਟ ਦਾ ਮੋਮੈਂਟ You know, जितना मैं पहले क्या कहते हैं डॉक्टर साहब you know because of the supermarket trolleys होया basket हुई petrol pump होया बीमारी उतने है या नहीं है just take a precaution there's no harm in that what would you like to say on that
Yeah, even with you know, I've seen with petrol stations or signs hegia that you know use the disposable gloves. You know, it's a good protection. I personally carry.
Sorry, ਉਹ ਪਤਾ ਕੀ ਹੋਇਆ ਜਿਹੜੇ ਉਹਨਾਂ ਨੇ ਉੱਥੇ ਡਿਸਪੈਂਸਰ ਰੱਖੇ ਹੁੰਦੇ ਸੀ ਨਾ ਲੋਕਾਂ ਨੇ 100 ਚੱਕ ਕੇ ਲੈ ਕੇ ਉਹਨਾਂ ਨੇ ਬੰਦ ਕਰਤੇ ਉਹ ਵੀ instead of buying it they empty the dispensers.
Gosh, and you know, obviously they all rakhi hote because they want for everybody to be protected, and it's a good thing that they were doing that. But you know, hopefully those robberies or those, you know, the stealings were few and far between.
Question काफी आगे टाइम बड़ी फास्ट जा रहे हैं you know I know everybody knows कि लॉकडाउन का मतलब क्या है can you explain कि गवर्नमेंट लॉकडाउन क्यों कर दी है knowing कि एक पासे जे अगर इन्फेक्शन रिड्यूस करने कर दी है and it's killing the economy so you know it's not really working 100% either way.
Yeah, you know, it's a more difficult decision, yeah, Vese, and I don't envy the politicians that have to make this decision because, you know, as a doctor, our decision is very simple. Health is the most important. Physical, mental health is the most important cheese, yeah. But at the same time, economy, livelihoods, these are vital to maintaining your health, you know, having a roof over our head, having food to eat, you know, water to drink. So lockdown has had, you know, an economic impact, but the reason why obviously the government had to look at this is because they could see the daily rates of COVID they were increasing. And what we know is as the rates of COVID increase, the hospitalizations will increase. So more people will end up being admitted to hospital. And if more people are admitted to hospital, more people will die from COVID. And government, it's their responsibility to make sure that we keep those numbers down. It's our responsibility as well to follow what the government guidelines are saying, to make sure that we protect everybody. That's the important thing.
Actually, time bala thoda tusi almost advice that deti hai. I'll ask you some more questions. I think I would like you to give some advice, general advice to the public. The most important is that to see my hands, mask and distance. Anything else you want to add on to look at the camera and look at advice? No, because we want to kill. We want to kill this disease, not kill the people.
Yes.
No easy way out. It's got to sacrifice a lot of things. They ਆਪਾਂ ਪਹਿਲਾਂ ਕਾਲ ਲੈ ਲੈਂਦੇ ਫਿਰ ਗੱਲ ਕਰਦੇ ਲੋਕੇ ਹੈਲੋ ਜੀ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ hello
Hi there.
hello thank you, welcome to the show. What would you like to say, sir?
I would like to say that Sarji, they're talking about everything that happens in the hospitals with the doctors. Yeah, it's a big error that's happening, and now they're creating these medicines. But what about the people who are dying in nursing homes? People who are dying at home, yeah, because they're scared to go to the hospital. What about that? Yeah, I talk to doctors. Yeah, I'm associated doctor.
I'll let Dr. Ji answer that. Nursing homes, I can understand. Vulnerable old people with ongoing both bimariyan hundiyan, but people from home, jeh they catch karde ne, what would you like to say on that?
I think the question was obviously people who have the other conditions are suffering with it at home because they're too afraid to go to hospital or speak to a doctor. And my advice would be, GPs are still open, hospitals still open. If patients are unwell, they should seek medical attention. It's more important there. That we get. I speak to lots of patients each day. My colleagues speak to lots of patients each day, and we are there to help. So actually, if they are worried about something, and if you've got a medical concern, seek medical attention.
टाइम बड़ा थोड़ा रहना मैं चाहूँगा कि जो भी तुसी घर बैठे हो एक्चुअली जो क्वेश्चन नहीं है ना जरा लॉकडाउन वैसे एक तो चलो बीमारी घट कर लिए लॉकडाउन वैसे तुसी ਮੈਨੂੰ ਕੋਈ ਵੀ ਰਿੰਗ ਕਰਕੇ ਦੱਸੋ ਕਿ ਤੁਹਾਨੂੰ ਕੀ ਫਾਇਦਾ ਹੋਇਆ ਕਰ ਲੌਕਡਾਊਨ ਦੇ ਵਿੱਚ ਓਕੇ ਕੀ ਨੁਕਸਾਨ ਹੋਇਆ ਫਾਇਦਾ ਇਨ ਸੈਂਸ ਯੂ ਗੈਟ ਮੋਰ ਚਾਂਸ ਟੂ ਸਪੈਂਡ ਟਾਈਮ ਵਿਦ ਦੀ ਫੈਮਿਲੀ ਬੱਚਿਆਂ ਨਾਲ ਆਪਣੀ ਔਰਤ ਦੇ ਨਾਲ ਕਿ ਤੁਹਾਨੂੰ ਜਾਸਤੀ ਨੁਕਸਾਨ ਹੋਇਆ ਫਾਈਨੈਂਸ਼ੀਅਲੀ ਉਹਦਾ ਫਾਇਦਾ ਨੁਕਸਾਨ ਰਿੰਗ ਕਰਕੇ ਤੁਸੀਂ ਕਰ ਸਕਦੇ ਹੋ Yeah, you were saying, ਜਿੱਦਾਂ ਹੁਣ ਇਹ ਚੀਜ਼ਾਂ ਹੈਗੀਆਂ ਇਹਨਾਂ ਦਾ ਕਾਲ ਵੀ ਹੈਗਾ nursing home ਤੁਹਾਨੂੰ ਪਤਾ the people are vulnerable, they're older people normally ਕਾਫੀ they end up in the nursing home because they don't have a family to look after, maybe they've got some serious illnesses ਵਗੈਰਾ and they just prolong their life by looking after them medically, look after ਕਰ ਦਿੰਦੇ ਨੇ but then they're vulnerable because ਕੋਈ flu ਹੋਏਗਾ ਕੁਝ ਵੀ ਬਿਮਾਰੀ ਹੋਏਗੀ they're the first people going to catch it ਬੇਸ਼ੱਕ ਦੀ In fact, am I right to say that the hospitals are bimariyan zyada lagdi than walking on the street?
In the hospital itself? Not necessarily.
It's a saying, no? A lot of log kehte
hospitals and even nursing homes, because Sunday practice, they see a nursing home look after Gardeya. And they have been excellent in making sure that they put the right measures in place to protect the residents. It's more important, yeah, because as obviously these patients have lots of medical problems and they are vulnerable to COVID-19.
Of course, yeah.
So they put lots of measures into place to protect the staff, the patients, and they're doing a fantastic job. Sometimes, unfortunately, there has been things in the news where COVID-19 has had obviously has been around in nursing homes, but it's important to keep working together to try and limit the number of cases and limit the outbreaks.
But majority of the people are happy with the NHS because they are front line, they worked very hard and obviously overload hospitals, NHS and the GPs, everyone. They can only do so much. But then people, maybe I think he was trying to say something ਘਰਾਂ ਦੇ ਵਿੱਚ ਬਹੁਤਾ look after ਨਹੀਂ ਕੀਤਾ ਗਿਆ, this, that happened, did you get that answer last bit or another? Nursing home, does he hear something about the home as well?
Yeah, he was saying that obviously Jirekar they're afraid to speak to a doctor, they just, because of COVID-19, they're afraid to go to hospital because of COVID-19. But, my advice would be actually hospitals are set up to protect patients. Obviously that's fundamentally what hospitals do. And if patients are unwell and it's an accident or an emergency, then hospitals are open. They've been open this whole time. If you're worried about a medical condition, then GPs are open. They've been open the whole time. ਤੁਸੀਂ ਸਾਨੂੰ ਵੀ phone ਕਰ ਸਕਦੇ and we'll help.
ਜਿਹਨੂੰ ਇਨਫੈਕਸ਼ਨ ਹੋ ਚੁੱਕੀ ਹੋਈ ਹੈ ਰਿਕਵਰ ਹੋ ਗਿਆ ਵਿਦ ਅ ਪੀਰੀਅਡ ਵਿਚ ਗਵਰਨਮੈਂਟ ਦੀ ਗਾਈਡਲਾਈਨ ਦੇ ਨਾਲ 2 weeks 3 weeks whatever been into lockdown ਦੇ ਵਿੱਚ ਉਹਨੂੰ ਰੀ-ਇਨਫੈਕਟ ਹੋ ਸਕਦਾ ਵਾਪਸ what the chances there?
So reinfection, this is a very important point, or dekhde see, because globally there are a few cases where they thought possibly reinfection ho chuka, and then that has a big impact on how we manage this disease.
We never had a figure on that, you know.
No, because again, there's lots of complicated factors with this. And at the moment, there was a study recently in August that showed, they look at antibodies, and antibodies are your body's way of defending against the viruses. And it showed that months after patients had COVID-19, or antibodies got see. The question was whether this means that a patient could be reinfected. At the moment, they don't have the evidence either way. So the guidelines are very clear that whether you've had COVID or not, just symptoms dwara hoge, then you have to self-isolate. Obviously, if you have fever, cough, loss of sense of smell, get tested for COVID-19. So because you've had COVID, it doesn't mean to say that you definitely cannot have it again. Or studies they're trying to find that information out.
ਪਰ ਉਹ ਜਿਹੜਾ ਜਿਹਨੂੰ ਇਨਫੈਕਟ ਹੋ ਕੇ ਰਿਕਵਰ ਹੋ ਗਿਆ
ਹਾਂਜੀ
ਐਡਵਾਈਸ ਨਹੀਂ ਹੈ ਲੇਕਿਨ ਤੋਂ ਖਾਸ ਕੇ ਉਹ ਕੀ ਕਰਨਾ ਚਾਹੀਦਾ ਉਹਨੂੰ ਜਦੋਂ ਰਿਕਵਰੀ ਹੋ ਚੁੱਕੀ ਉਹਦੀ that person can't openly walk around somewhere because he could be infected back again with
so exactly so there's no evidence to say that they are definitely protected. Everybody should follow the guidelines, everybody should make sure they keep themselves safe and others safe, whether you've had COVID or not. It doesn't matter, it's same guidelines.
Time bala choda, only about a minute renda, it's about to finish. Bala gala karde se bala interesting gala, hope to we show acha lagega. Next week ko acha show leke avange, please always 9:30 baje Akaal Channel te Sky 7770 watch kara karo. बहुत important है दे विच दो तीन गल्लां निकले मैं थोड़ा पॉइंट कर देना फ्लू ते कोविड ਜਦੋਂ ਵੀ ਹੋਵੇ ਨਾ ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਡੋਨਟ ਥਿੰਕ ਕਿ ਮੈਨੂੰ ਲੱਗਦਾ ਇਟਸ ਆਲਵੇਸ ਬੈਸਟ ਟੂ ਗੈਟ ਇਟ ਚੈੱਕਡ ਇਮੀਡੀਏਟਲੀ ਫਲੂ ਵੀ ਹੈਗਾ ਜੀਪੀ ਨੂੰ ਰਿੰਗ ਕਰੋ ਅਗਰ ਤੁਹਾਨੂੰ ਜੀਪੀ ਨਹੀਂ ਮਿਲਦਾ ਟੈਲੀਫੋਨ ਕੰਸਲਟੇਸ਼ਨ ਹੁੰਦੀ ਹੈ
telephone consultation ਹੁੰਦੀ ਹੈ but if there's concerns about flu get tested.
Dr. Ranj, thank you so much for coming. I'm very pleased to see you. And next you're going to come in, we're going to talk about the diabetes. I want you to give me a quick promise you will come back again.
I promise.
He's promised on the national TV. And ਜਦੋਂ ਮੈਂ ਕਾਲ ਕਰਾਂਗਾ ਮੈਂ ਨਾ ਨਹੀਂ ਕਰਾਂਗੇ ਪਲੀਜ਼ ਹਮੇਸ਼ਾ ਮੈਂ ਕਹਿੰਦਾ ਨਾ ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਸਪੋਰਟ ਕਰਿਆ ਕਰੋ ਅਕਾਲ ਚੈਨਲ ਦੇਖੋ ਕੋਸ਼ਿਸ਼ ਕਰਦੇ ਨੇ ਦੇਖੋ ਜਿਹੜੇ ਵਿਸ਼ੇ ਹੁੰਦੇ ਨੇ ਮੇਰਾ ਮਕਸਦ ਇਹ ਹੁੰਦਾ ਕਿ ਤੁਹਾਡਾ ਭਲਾ ਹੋਵੇ ਕਿਸੇ ਦੀ ਜਾਨ ਬਚੇ अगर एक बंदे की जान बचेगी तो मैं बहुत अच्छा लगेगा कि कोई मैं अच्छा काम किया। नेक्स्ट वीक में मुलाकात होगी, तब तक रब रखा। सत श्री अकाल जी।